Hello everyone, welcome to my show, NainaMD, Fusion of Science and Beauty. And today I'm going to have a guest who is a certified esthetician, Shara Jones. She's been an esthetician for at least 6 years. And I think it's so important with the anti-aging regenerative medicine approach that and the awareness that I'm trying to create to talk about chemical peels. So many of us have known chemical peels over like 50 years they've been around. But the way we do them and what we're doing now and are they still a place for chemical peels has really changed. There's very harsh chemical peels which require downtime of sometimes several weeks, and then things got better and now it's a few days to a week, and there's so many different kinds of chemical peels. So Shara, would you just tell the audience a little bit about the different kinds of chemical peels there are, and then we'll talk of course we'll get into the latest greatest, but at least give us some history on the chemical peels and what you as an esthetician found along the way, what some of the problems, some of the good things, some of the bad things, the pros and cons, so to speak, of chemical peels.
So the latest and greatest chemical peel right now is the Vitality Institute chemical peel.
But before we talk about that, what were some of the things that you, as a chemical peels, that you came across? Like, were they too harsh? I mean, just give some history on that. Absolutely. In your experience.
Absolutely, Dr. Naina. So there's the Jesner peel, which is a unique combination that's created by an esthetician by a percentage of salicylic acid, right, of retinol acid, of lactic acid, and it's chemically mixed together for a specific treatment, whether or not that be anti-aging, whether or not that be hyperpigmentation, melasma, or acne. And so that's a harsh peel where you're going to have anywhere from 2 to 4 weeks downtime where you're not able to enjoy your activities or go in the sun. Right. The skin tightens.
And who has time for that? Honestly, the results are good, but who has time? I don't have time for any longer for doing 2 to 4 week downtime peels. I'm traveling. I need to be out in the sun. People are, people who live in warmer environments. I mean, what do? They can't wear a hat for 4 weeks. So I think it was a great peel, great results, but it's just not practical, is it?
It's not practical, and it also changes the chemical balance of the pH level of the skin, Dr. Naina. So you might incur like additional acne.
Well, I start to see a lot of patients. I start to see patients back with a lot more of, and also sensitivity, because sometimes a mantle, a layer of the skin is also breaking down. Sometimes some of the things that can happen is that it's a sensitivity issue, itching, a little bit of itching or more breakout. And people then have to deal with not only the downtime, but then you have to go through a period of the breakout. And so it just elongates the process, and especially now that we have combination lasers and peels that are just much better, I think that's why I really wanted to open up that discussion. One of the things too is that the lactic acid, glycolic, there's so many different kinds of acids that you can use for peels, is it not?
Absolutely, and the chemical balance of those types of peels can be uniquely blended by an esthetician like what we just spoke about, or a unique mineral blend created by Dr. Khalil with the VI peel, and this is very little downtime.
So talk about this now. It's the latest greatest. I think it should be in everyone should experience that. We talked about the Fire and Ice facial last time, and that's just a nice, safe facial to have. But if you want to do something a little bit more to the skin, you want to go to that extra step, so to speak. The next step of rejuvenation, of the next step of smoothing out the fine lines and wrinkles, the next step of exfoliation, the next step of smoothing out and toning out the texture would be, I think, the V peel. So so tell me what's in it. How do you do it as an esthetician? Give me the whole procedure that you would normally do, okay?
Absolutely. This peel is a medium depth peel. It's going to penetrate the top 4 layers of the epidermis of the skin. So that's the outer. So the epidermis
for the audience is the outer layer of the skin, right?
Yes,
okay.
Correct.
So it goes through all the layers of the outer layer of the skin, all layers of that, okay? Then it goes a little bit into the.
So it's suitable for all skin types because it goes into the dermis layer of the skin, and it's a unique proprietary blend that's very safe.
I think it's so important for the audience to know that it's suitable for all skin types, because so much of the things that we're worried about is, especially as we become more of a diverse global nation and world, we're mixing different ethnic blends and so forth. So we're going to carry those genes and those melanocytes. And so it's so important then to have a peel that's going to be safe then for all the skin types. We don't want to be able to do a peel and then have problems with hyperpigmentation or that you're getting scarring because you didn't realize that this person had more active melanocytes or something of that sort.
Absolutely, and with this unique blend of salicylic acid, retinol A, TCA, and it is a very gentle blend, like we said, for all skin types. So
TCA is, by the way, a tricarboxylic acid. All the time I talk about synergy, and almost every show I mention that word, but it really involves a synergy of all of these acids that can work together to create a wonderful environment to peel the skin then effectively.
Yes, and this is a very quick and easy and safe peel with very little downtime.
How do you do it? So can you explain to the audience, like, what do you, like, this is the entire value you use?
This is the entire value of the peel.
Okay.
And
so what do you first do? So let's say the patient comes to you, the client comes, what are you doing?
So what we're going to do is first we're going to prep the skin. We're going to eliminate any excess oil on the skin so that the skin and the pH level are ready to accept the chemicals. And then it takes about 20 minutes to put the chemical on with the gauze.
I think it's important to mention this. When you say prep the skin and before and prepare the skin, now if you never had anything done, okay, let's say you just got this, that's fine. You're going to still get a result. But you get a better result if you start to prepare the skin in much less expensive ways, such as like you could do a fire and ice facial, and you can start with some just minor exfoliating and like a fire and ice facial or other facials. Then you know that the skin is being cleansed. That means nutrients are going to go readily more penetrate. So now you're creating an environment where the skin is going to be able to receive all the penetration of the acids that you deliver. So if you've done some other treatments that are just less expensive, that's actually a good thing, because now you're ready then for the V peel. You see what the point I'm trying to say is, like, you need to prepare and don't waste your money just like never doing anything and then going into a V peel. At least do some other things so that you're starting to prepare the skin, and the skin is starting to exfoliate, start some exfoliation process, so that by the time you come to the V peel, it's going to really then be able to go right in and give you the results that you need.
Absolutely agree, Dr. Nai. We want to make sure that the skin is as clear from acne as possible, that we have an exfoliation method at home that we're using that unlocks the intercellular glue.
Which one do you like? Which exfoliation method do you like?
There's several methods of exfoliation. Yeah. You can use the serum. My favorite way to exfoliate is with the active serum from Is Clinical.
Yeah.
And
you also like the
enzyme pumpkin exfoliation, because the enzyme really, like I said, unlocks the intercellular glue and just melts away the dead dry cells, so we can get a good product penetration.
I really like that one
and
too.
We can get a good moisturization and penetration from the chemicals for the peel or from the serums and creams and masks from the facial, and so that the skin is prepared and at the right pH level and in the best suitable manner that it can be in order to get the best initiative out of the peel, like the VI peel, with little downtime.
Yeah. What downtime?
So first, it just takes 20 minutes to apply the VI chemical peel. It's a very easy and simple procedure. It could be a little bit uncomfortable, some tingling, and obviously the scent of the chemical could be a little bit, agitating to the patient. However, it's very feasible. Within 20 minutes, you can be in and out of the office.
So, there's exfoliation is so important. So tell me a little bit about the different kinds of exfoliations that you're familiar with and that you think are good.
Absolutely. There's several ways to exfoliate. You can exfoliate with a Clarisonic. You can exfoliate with a serum.
Clarisonic is amazing, right?
Yeah.
And what is it? Clarisonic is that it's a power operated, right?
It's a power operated.
That's kind of Is it kind of an ultrasound vibrational type
Absolutely.
technology?
And it's just going to lightly remove the top few layers of the dead dry skin and obviously constrict the pores so that pollutants and free radicals stay out of it. I would recommend using a certain method of an exfoliation 3 to 4 times a week, Dr.
Yeah, so the Clarisonic is one.
Absolutely.
What's another one?
My favorite way to exfoliate is with a serum. The botanically based Is Clinical Active Serum has an exfoliant in that.
Tell me about Active Serum.
So Active Serum is the perfect way to prep your skin for a VI peel, because it's going to lighten and brighten the skin and inhibit the production of melanin. It's going to be an exfoliant. It's going to smooth out fine lines and wrinkles and exfoliate the dead dry cells, and then it's going to kill that acne bacteria so that the skin is ready to go for a VI peel.
Very nice. And then what about so you've got the Clarisonic, so we've got the active serum, okay. What about that pumpkin?
The pumpkin enzyme exfoliant. The enzyme's wonderful because it really goes to the dermis layer.
Talk about some of the enzymes, because that's so much is used by estheticians.
And the enzyme goes to the dermis layer, Dr. Naina. So what that's going to do is just unlock the intercellular glue and just melt away the dead, dry cells. And so we can have a good product penetration for the chemicals, for the VI peel.
I really like, that's a favorite of mine.
Absolutely.
And then there are also enzymes, there's a papaya enzyme, right?
And that's more of a papaya, pineapple, vitamin C, and that's for the really sensitive skin type. And that will be a little bit more gentle and give you that nice radiant glow and infuse your skin with the vitamin C, but still melt away the dry cells. So we could use that based on, you know, the customer.
So now you've exfoliated the skin.
Right.
You prepped, exfoliated. Now, does this entire vial,
the entire vial goes on the face. So what we're going to do is go around the face with some gauze. We're going to start on the forehead.
Okay.
And then we go over the eyelid on the third pass. We'll do anywhere
from
5 to 7 passes.
So passes is where you apply it all throughout, is considered one pass, right? When you apply it first time on the skin, on the face. Then the second time is the second pass, right? So you do about 5 to 7 passes.
Absolutely. Wow. So the first 2 passes we're going to go on the entire face and down to the neck. And the second pass the same, and then on the third pass we will go over the top of the eyelid and under the bottom of the eyelid. Just one time, which can be uncomfortable.
Because you don't want to overdo it, so that's why you just do less passes around the eye area. It makes sense.
And we really need to lift and firm the eye and then smooth out any soft fine lines and wrinkles below the eye and on the side of the eye to enhance
how long,
that
so once you do the like 7 passes, how long do you leave it on?
So once you put the chemicals on, you leave the chemicals on for 4 hours. You're going to go home after the procedure, which takes 20 minutes, and you leave the chemicals on for 4 hours. We send you home with the post-care kit, where after 4 hours...
So do you have to neutralize it? Do you have to neutralize it at all?
You do not have to neutralize it.
Isn't that nice?
It's very simple.
This is why
it's a mid-depth peel.
This is why I wanted... So this is my whole purpose of this segment, is because I want the audience, the audience, to realize that you can actually go home with this peel. And because it's a medium depth peel, so that if we're allowing you to go home and we're not having to neutralize the acid, it can't be all that severe. So that's a beautiful part of that.
Right, and it's really not going to be too uncomfortable when you get home. You might have a little bit of feeling like a sunburn. Okay? So after 4 hours, you will wash your face with the gentle cleanser, and then you will take a pat dry on the skin, and then you will take a post-peel pad from VI that we send you home with, and you will reactivate your chemical peel at home with the pad in the same format that I applied it. It takes about 5 minutes at the most.
And then do you leave that on for how long?
And you leave that on.
For how long?
You leave that on for the end of the night, and then right before you go to bed, 1 hour before you go to bed, you're going to actually cleanse your face again, and then reactivate the peel again for the second time.
Right.
Okay, and so we're going to reactivate.
So that'll be the third time. You've had your peel. You've had your peel. Then the first reactivation, and then the second reactivation.
Right,
so 3
you have your peel. Then 4 hours later, you reactivate, and then 1 hour before bed, you're going to reactivate the peel again.
And you wake up.
And you wake up, and you will not see any peeling yet. You're going to peel like a snake. So you're going to lightly peel the top 4 layers of the skin for the next 4 to 10 days. So we want to make sure that we're using our post-peel protectant cream, which is a 2% hydroquinone cream and hydrocortisone. So it's going to keep lightening and brightening, and it's also going to go ahead and soothe any irritation.
And you'll get fabulous looking skin, right?
Absolutely.
Because that's the whole idea, is we've accomplished the peel, minimal downtime, and it's just an amazing rejuvenation, regenerative anti-aging treatment. I'm so glad to have you on the show. We'll be back. We're going to talk about another kind of treatment next time. But I'm very happy that you came on, and we've had you first talk about the fire and ice, and now this is a V peel. We can use them in combination.
Absolutely.
This is NainaMD. We'll see you in a little bit with my next guest, NainaMD, Fusion of Science and Beauty.